share many tips and also some of the things which they, I think, forget to ask the doctors or are not aware, and which the doctors want to tell them, but normally in a busy OPD there is not enough time and space to discuss. So this is we have created a time and space where the doctors can actually talk and share the things they wish the patients would know. So I'm so delighted to have you here.
Thank you, Dr. Shikha. I'm delighted that you have invited me on this webinar, and I'll see what I can contribute to it. And I know you are the right person to prevent the people coming to me.
No, so actually, I'll give you a small background. To the audience, the reason I got into this field was because I saw that if you look at the number of doctors every year which pass out, they're very, very, very small number compared to the population. So a country has 1 billion population.
Yes.
And on an average, the number of doctors who pass out from, MAMC or Lady Harding or AIMS are very few. So fundamentally, I thought that India can never get enough doctors. That is out of question. Now, the only thing which can be done is that if the doctors, the people who reach the doctors are the ones who are in emergency or in those conditions which are not self-created, which are something which could have been controlled. And even after the surgery, like I still remember, when I was at GP Pant ICU, after one patient recovered out of a heart attack, he actually sent us huge number of biryani, and with full of oil. So I realized that this patient will come back because he doesn't know that what caused the heart attack.
Yes.
So I thought that at least after the surgery, people should learn from their mistakes, after that. So that's how the whole concept came up. So today we have got a lot of questions, but I'll tell you what is the format of this webinar. What I'll try to touch upon is that after the surgery, what are the things you should be careful about, like suppose a gallbladder surgery or any other surgery which you have already got done, so that you don't have a failure or you don't have problems which you would have prevented after the surgery. The second thing which is very important is that what is the reason that people have the health issue? Like, for example, if somebody is having gallbladder stones, if somebody is having, acidity, gas, so that people understand their bodies and they take more responsibility and they become a partner in health, that healing, rather than that, now Dr. Manish is going to play magic and after that I'll do whatever I was doing. So that's where I want to kind of bring that partnership of patient and doctor. So I think we have collected a lot of questions. So we can start with some of those questions, and I'll take the natural part of it, the food part of it, and then I'll pass the question on to you. So Nitin, can you start with the questions?
Definitely. So collected more than 50 questions. So I'm going to select few questions and ask us. So let's start with acidity and constipation, because that's where the trouble starts, right? Then it starts escalating and it gets into very serious levels. So when we talk about acidity and other digestive issues, so there was a question that whether it's digestive, whether it's genetic, sorry. So like if my dad has it, will I get it? So that's a question our audience had. And what about food allergies? How can one basically treat food allergies?
Okay, so there are a lot of conditions in GI which have a genetic basis or a genetic connection. But having said that, it's also important that even if you have a genetic connection, it doesn't mean that the lifestyle and environment cannot change it or improve it. To give you an example, that if you have a tendency towards acidity in the family, so one part is the way your body responds to certain food, which is called the post-digestive impact of foods. But the other thing is also the way your emotions are, your behavior are. For example, some people are very calm by nature, but some people react a lot. They are hyper-reactive emotionally also. So if there is a combination that you have a genetic factor, on top of that, you are having a lot of fried food, alcohol, smoking, your diet is full of refined food like maida and suji, you're not having fiber in your diet. So that means you are contributing to that problem. And on third, emotionally, if you're hyper and for small things you get irritable and angry, then all these three things, your genetic makeup, the kind of food you're having, and the kind of reaction, emotional reactions you continuously display, they all then add and make the acidity worse. So the first step is understanding your own body and your own way you are handling your body. So that's my short answer. Over to you, doctor.
Yeah, I agree, totally agree. But the thing is that there are certain diseases which lead to acidity, which can be genetic. Though genetic, as you rightly said, genetics does not mean that you cannot modify it or can't alter it. Like gallbladder stone, if you take, it leads to, it's a very common cause of acidity in North India. But in South India, you don't find the disease. Till date, we have not been able to find why this disease is so prevalent in North India, but is not there in South India. On vice versa, you see gastric ulcer, peptic ulcer diseases, which are very common in South India, not so common in North India. So these are lifestyle diseases, maybe environmental related diseases, or food habits related diseases, which can be easily modified by the right advice by the dietitian or whoever is giving you the advice. We need to understand our body. People saying that this is bad for you is does not hold good for everyone. Certain things may not suit me, certain things may not suit you. So you have to modify your lifestyle according to your body's need. Like Shikha will be very familiar with gluten allergy, milk allergies. So for certain people, milk is the best thing in your diet, and for certain people, milk is the worst thing in your diet. So I come across patients when they have tried their home remedies, they have gone through the lifestyle changes, and then they come to us for acidity. Then we try to investigate to find some other cause other than lifestyle if that is leading to the problem. And if we find it, we try to solve it. Otherwise, the patient has to modify the lifestyle, food habits. Certain normal precautions we tell to all the patients is not to sleep for at least half an hour after having food.
Yes,
Regular lifestyle is something which is very important to maintain intestinal health, I can say.
Very well said. Because one of the things which is coming up in the field of wellness and nutrition is nutrigenetics, which is nutrition according to the genetic profile. Like for example, slowly pharmacogenetics is coming, that is medicine tailor-made to the genetics. So even nutrition tailor-made, or like you correctly pointed out, that different people respond to food differently. In fact, I would give a very interesting example. So initially when I set up my practice, so I came from a medical understanding. So I used to only understand milk, that calcium or
Yeah.
which protein and fat is there. So the whole comment, but people would come and tell me that no, when I drink milk, I'm getting phlegm, or somebody would say something else. So I could not understand. I thought it was psychological because at that time there was no concept of this differential post-digestive impact. But later I realized it's true. Different people digest food differently, and how, like, for example, everybody who eats parantha doesn't put on weight. And
Yes.
everybody, so even how people gain weight and how they respond to carbs is very different from different body types. And I think well said that you have to understand your own body and not just follow blindly other people.
Yeah.
Yes. Yes. So Nitin, I think you can carry with the next question.
right. So again, when we talk about acidity, right, there was a specific question to Dr. Manish that somebody is having a pain in the upper quadrant, in mid and left side. So what does this mean, and what should the person do?
It's too general a problem, but acidity with this type of a problem, first is to be sure that you don't have any other medical condition. A simple ultrasound will rule out a few conditions which can lead to this acidity with this pain. And if the ultrasound is normal, you have to maintain your lifestyle and dietary habit. Need to rule out gallbladder stones, which is a very common upper quadrant pain with gastritis. And at times it is only picked up by an ultrasound. The symptoms are not severe. Patients keep on neglecting it because the symptoms are not severe. And very commonly it's picked up during pregnancy when they go in for ultrasound for pregnancy, and then by chance they detect this stone. And the other common cause for this type of pain is gastritis or gastric ulcer, which again is becoming a very common problem because of our lifestyle, our food habit, eating more of spices, eating spirits, cigarette, everything contributes to it. So first lifestyle changes, if still not being able to manage it, go to a doctor, get investigated, rule out the basic diseases. If the basic diseases are not there, then you have to find a solution yourself.
Right.
Okay.
And I would like to add to that. A lot of times people, when they come to us, they say, "Oh, my friend lost 5 kilos in 1 month. I want to do this 5 kilo loss in 1 month quickly." And then the others say, "I'm on a keto diet. Somebody's on an Atkins diet." So one thing I want to place is that what happens when you do a pure Atkins diet, your body becomes acidic and your gallbladder also starts, crystallizing because it becomes very acidic. The environment becomes acidic. Similarly, on a keto diet, when all the vegetables are out of the window, I mean, people are hardly eating vegetables or fibers and they are going on a pure keto diet, what happens, the whole environment inside, the bacterial flora keeps changing. And on a pure keto or a pure Atkins, the gallbladder is highest at risk. I have seen so many people who do these strange crash diets and they end up with the gallbladder situation, with the gallbladder pain or gallbladder stones. So one thing which people forget is that if you are having a diet which is pure concentrated protein and keep pure keto, then your acid alkali balance will go out of phase, and you might, especially if you have a tendency, end up with gallbladder stones.
Yeah, and it's a very this keto diet or high protein diet. I'm not against it. I don't know much about it, but I can say that they lead to certain constipation problems, piles problem, because they eat this high protein diet. They don't feel hungry. Otherwise, the fibers go down in their diet, which they don't give importance to, leads to constipation. Constipation leads to multiple other problems. Nowadays, we very commonly come across patients who are going to the gym, young males and females who go to the gym, exercise, and they buy nutri products from there. And we don't know what is in there, but it makes them look good. It makes them feel good. But these are the people who develop constipation. These are the people who develop piles very frequently. So my first question when they come to me, if
Right,
I see
doctor.
a young, healthy
And
patient like me, I've asked them, are you taking some uh,
hello. So
gym
when we talk
products?
about acidity,
So, so
sorry, doctor, I
acidity,
think we were
yeah, I agree. Acidity is also again very common if a balanced diet is not there. If you are not uh, keeping distance between your food and your sleep pattern. Now the shift duties again is a big cause of acidity, in which you're not sleeping at the right time or you're sleeping at different time, different days. That also lead to acidity.
So
right.
I just wanted
And
to add a question there. So, a lot of people, when the acidity starts, what they try to do is they take like 4, 5 antacids together. Or, I mean, is it okay, not okay? What is the right way? If at home you find that somebody is just kind of popping a couple of antacids together, what should the right thing be?
Most of the antacids in the allopathic medicine has a specific dosage. So you're not supposed to be taking more than that. A simple antacid, all antacids have certain doses, and we can't keep on popping them like sweets. So if certain amount, the dose you have taken the full dose still not effective, then you have to find some other solution. Medicines cannot be a solution, especially medicine, unprescribed medicines should not be the solution.
right. And when we talk about acidity, right, food has a major role. And we had a question about what kind of food should we take to avoid acidity. So basically, what are the alkaline diets which we should be prescribing?
So I think I just add to that, like what happens when acidity happens, and I'll take part of the question. And Dr. Manish, please correct me if I go wrong, because I've done medicine so many years back, I could have forgotten some of it. But what happens is that actually there is a lot of acid in your stomach, which is there to digest your food. Now, when some of it regurgitates, it comes up and it hits the esophagus, which is your food pipe. Now, the stomach has a very thick lining, which can handle or which can keep that acid inside without spoiling your tissues. But when this acid jumps up and into the food pipe, which is called the esophagus, that's where you actually feel the burning, because the food pipe is not designed to hold acid. Now, first thing would be, you'll wonder, why does it jump up? Now, it jumps up because of a couple of reasons. First thing is that there is also gas in your body, and that because of the gas is pushing the acid up. So obviously, the gas is caused either by you're eating a wrong kind of oil, or you're not having enough fiber in your diet, or you're super anxious, you are hyper, breathing, uh, you are eating kind of foods which in any way are not conducive to that digestive process. They are causing this kind of movement in the stomach. The third thing obviously is that your entire diet is so full of acid causing food. Now what is an acid causing food? Milk is an acid causing food, dairy products, breads, maida, suji, parantha, puri, bad oil. And I'll come to bad oils even later. That what is a bad oil? Bad oil is not just the kind of oil, but how it is processed, how it is refined. So bad oil, not drinking enough water. In fact, most people are surprised. Most doctors would be surprised to know that people should be drinking at least 2.5 liters of water. They're drinking just under one bottle of water, because they just don't drink enough water. And if you don't drink enough water, you are basically concentrating all your acids inside your body, because water is a natural pH balancer. Fiber. People, in fact, I've heard so many teenagers and their parents also who say, no, we don't want to waste tummy space for eating vegetables. I like chicken. I don't want to waste any space for any other food. So if you're having whatever food you're having, but you're not having enough fiber from vegetables, then the imbalance is huge. And the body cannot handle that imbalance, and the symptoms start coming, and acidity and bloating, irritation, all of them are the whole pattern of symptoms which start coming in. So even if you are slim, even if you don't have a weight issue, it doesn't mean that you don't need salads in your diet, because salads have a huge role, and I'll come to it later, that how we are realizing that a lot of intestinal problems are coming because human beings have stopped eating salads, which are raw diet, and raw foods have a very important role in our whole body.
Yeah. Shikha, you have explained it very well, the cause of gastritis, that esophagus part, that is really right. And that is the cause. Causes can be, the causes leading to it may be multiple. There are certain medical causes also, like hiatus hernia, but those are rare causes. So what you have explained sums up everything.
Thank you. So, no, so I remember little medicine now. I'm so happy.
100%. Not little. You remember it very well.
Right. And before we move on to other issues, right, there was a specific question where the viewer is describing the symptom. Like he or she is saying that I feel like the food is coming back in the chest area, and there's a burning sensation in throat whenever I go to sleep. And there is also a sensation of sour, acidic taste that persists in my mouth. So I think the patient wants to know what exactly is happening.
Yeah, so this is what Shikha has explained, that acid coming into the esophagus gives these symptoms. But again, what she feels that food is coming back, that is because there is a sphincter between the food pipe and the stomach, which prevents the things from coming back to the food pipe, which causes the symptoms. So if this is laxed, that is in a hernia, that's called a hiatal hernia. These symptoms can be the cause. So such a patient needs an upper GI endoscopy. Upper GI endoscopy will diagnose the disease specifically, and if any medical or surgical treatment is required, that can be very easily advised. If this is a persistent symptoms which the patient is having for more than 6 months, they should go and get an upper GI endoscopy done.
So I think it's important over here because a lot of people don't understand what upper GI endoscopy, what happens. So can you just explain what happens? And they get scared, then they avoid. So can you just explain?
So whatever we were discussing, that the food pipe ends into the stomach. So the esophagus ends into the stomach. And at the junction, there is a valve. So we have to see whether this is normal or not, or if the esophagus and the stomach is normal. How do we see this? So we, in an endoscopy, what we do is in a mild sedation, we introduce a camera attached to a thin tube through the mouth into the food pipe and through it into the stomach. And this camera shows the image on the monitor. And we can see the gastric lining, the esophageal lining, the hernial part, whether it is normal or not. And depending on this, what we see, we advise the patient what is to be done. So peptic ulcer, gastric ulcers, hernias, hiatal hernias, esophagitis, H. pylori disease, all are diagnosed through this investigation. It's a very simple OPD procedure. You come and go back home in 1 hour.
So is it painful? Because a lot of people are scared of pain.
Yeah. So it gives, nowadays we have got something as called as spray anesthesia. So before the procedure, they spray it in your throat so that the feeling of gagging sensation is reduced. or is not there. And in certain patients who are very anxious, a small dose of sedation can be given. It's 5 minute sedation, which will keep the patient totally pain-free or discomfort-free during the procedure.
Okay, that's quite a relief to know that.
Right. So before we move on, just one last question. And this is about, we discussed about keto and other diets where there's a high protein content. And how true is it to avoid having proteins and carbs mixed in dinner?
See, what happens is that proteins need a acidic environment, and carbs need a kind of a basic enzymes, which get activated. Now, proteins and carbs specifically together, they become a little heavier combination. Now, when we say that you are having, say, a big bowl of rice and you are having mutton curry, or you are having paneer curry in it, now this combination becomes heavy. If you are not exercising, if your digestion is not good, if if you are having recurrent acidity and all, so what happens? Your body has to work extra hard in kind of digesting a very heavy carb with a very heavy protein. Normally, if you have digestive issues, it is easier to digest if you are having protein with a lot of vegetables and salads, or if you're having carb with a lighter curry. But having said that, it's important that some of the basic hygiene factors for keeping your gut healthy, and we will touch upon why today the intestine is called the second brain of the body and why it's so important. And slowly the immune system is also linked to the intestine and it's becoming very, very important. Why all those things need to be understood. But in a basic answer I'll give you, if you're not exercising, if you're not having fiber, then these combinations are very heavy for your body.
Thank you. Thanks for that, doctor. Now, moving on, when we talk about diarrhea, is there any specific herbs or food items which can, help with such a situation?
So before I take that, first I'd like maybe Dr. Manish can take up that, what are the things doctors rule out, or what are the reasons for diarrhea which can happen, and what are important things which the doctors rule out before we switch to the natural treatment?
See, in India, the most common cause of diarrhea is infective diarrhea because of whether the less of hygienic food. Infective diarrhea is the most common cause of diarrhea. It is viral. In adults, it can be bacteria. The other common cause is certain diseases like Crohn's disease, ulcerative colitis, they are chronic disease. Diarrhea is not responding to any medication for years can be cause of these diseases. And most of us MBS is certain infection in MBS which cause diarrhea. Certain times diarrhea because of food allergies, and I think we'll be in better situation to say about it.
Right. So it's been said that there could be infectious diarrhea because of infection. They could be due to food intolerances, some have wheat allergy, some have dairy allergy or intolerance rather. And in some cases, it's also psychological. Some people before exams start getting a loose motion. So each of these different kinds of diarrheas would have a different kind of solution. Like for example, if it is psychological stress oriented, people are running to for some sort of loose motion, that is actually self-controlled. All you have to do is take little bit of probiotic like yogurt you can take, or any probiotic capsules are good enough. Take coconut water, hydrate yourself, avoid outside food, and don't take heavy foods. Like don't have biscuits and paneer and dals if you're having a loose or a delicate stomach. The second, which is infectious, obviously will depend on the kind of infection. If it is like viral, then you can't do anything. You just hydrate yourself and take turmeric, which is haldi. So in warm water, put a pinch of turmeric and drink that 2 or 3 times a day, because that's naturally anti-inflammatory, anti-infective. And of course, you can also ensure that in your diet, you are taking amla to boost your immunity. And hydrate yourself with coconut water and general fruits. So obviously avoid strong citric acid fruits, and avoid papaya and pineapple because they will worsen the diarrhea. Avoid milk also. In diarrhea, milk is not given. But in case it is food intolerance, then I would suggest get a test done, because you need to identify what intolerance you have. And finally, a little question I think I'll ask you about ulcerative colitis and Crohn's disease. How would, if somebody is having on and off loose motions, how would they differentiate, or how would you know, how would a patient know that they need help?
See, a frequent stools at times stained with blood is a common feature in these diseases. Then along with this is pain in the stomach. Pain abdomen is very common. And at times it is hereditary also. So usually patients, whoever has ulcerative colitis or Crohn's disease, they keep on taking treatment, take dietary change, and still they don't respond. Then they reach the doctor, and then again the investigation is done in form of colonoscopy, which is the diagnostic test which takes them. Clinically, you can never be sure that a person has a Crohn's disease or ulcerative colitis. Only colonoscopy, like we talked about upper GI endoscopy, this is colonoscopy, it is lower GI endoscopy, in which through the stool passage we go in and see the large bowel and the small bowel, large bowel basically, to find if we can find the reason for the diarrhea. And we take a biopsy, and if it confirms that it is either of the two, then we start treatment and patient responds very well.
Right,
Right.
right.
I'm actually facing some issues with my audio right now. So I'm just going to post a question and I'll just connect back. So there was a question on what are your views to consume fermented whey to control GI disorders? I'll just connect back after this question.
Sorry,
So what are your views to consume fermented whey to control GI disorders?
Okay. So what I would say is that fundamentally fermented whey or any yogurt or any of these they are basically to give probiotics. Now a little bit about probiotics which I want to explain is probiotic means probios and bios means life. Now for which pro life we are talking about, it is the pro life of the bacteria inside your stomach. So mostly when we talk about bacteria, we talk about infectious bacteria, but there are a lot of millions and millions of healthy bacteria which live in your stomach. And any food product which gives them health is called probios, which is pro healthy bacteria food. Now, traditionally, yogurt and kefir in the Middle East, they are all full of these probiotic kind of foods which actually help the good bacteria to multiply. Now, to give you an example, that suppose if you have any infection and the doctor gives you antibiotic, they will also give you a probiotic along with it to make sure that if antibiotic is killing the bad bacteria and also killing the good, the probiotic given in the prescription will kind of cover up the good, will recolonize the good bacteria. One thing which I've also seen is that many people are taking over-the-counter painkillers and many of these other drugs which actually should not be taken regularly. And because of that, their colonic bacteria balance is not there. So yes, I would say that these probiotics are excellent. We should take them. Another thing is prebiotic. Prebiotic is prebios, meaning that foods which actually improve the bacterial, their own consumption or the digestion done by the bacteria. And like banana is very good. Fiber foods are very good. So even off late, and again, I think, please correct me if I'm wrong, that when we studied, appendix had a zero function, but today it's been linked with, I think, some probiotic connection. Is that, or is it still appendix is?
Still, there's no final
Okay.
on this. But you are right, probiotics are very necessary. The good bacteria not only helps in the digestion, but it also keeps the bad bacteria under control. So chances of you getting infective diarrhea is very less if the good bacteria is good enough.
Right. So since we are in Corona times, a little bit about, if you could talk about people who have good immunity. Am I audible?
Yeah.
So the gut immune system, and why is it important? Could you shed some light on the intestine and the immunity? And there's so much being talked about immunity, the lining of the intestine which has immune systems or the nerves.
See, I'm not the right person for that. Being a surgical specialist, I don't have much technical knowledge about it.
Yes.
So, and I don't want to say something which is technically wrong.
Okay. So I think what we will touch upon is that, you know, a lot of doctors, and especially in the wellness area, have started talking about how to keep your gut bacteria and your immune cells healthy in the intestine. And some of the things which have been spoken about is that the usage of prebiotics, probiotics, and the fact that, you know, when we say gut instinct, it is basically that the intestine is an interface between the outside world, which is the food, because the food is also carrying its own micro intelligence, or its micro, you know, kind of chromosomal information. And that chromosomal information is interacting with the intestinal information, the chromosomal information. And at that interface, the immune cells are actually getting sensitized. And that is why it is important not to have junk food. Like, you know, uh, if you talk about junk food, a lot of people say, but why is it junk? It is junk because the preservatives, the chemicals which are getting added to the food are actually kind of, they are like, what would I say, they're short circuiting the intelligence. Because they are outside chemicals, they were not designed to be eaten by food, by humans. So humans were not designed to eat these chemicals. So when they go inside, they short circuit the entire communication. And that is why junk food, I'll give you an example, you know, Dr. Manish, I had a patient about 15, 18 years back who was very argumentative. And so we stopped him from having sugar. He went on diet drinks, you know, that zero cal and all. And he was very wealthy, so he used to import them, buy imported diet drinks. And he landed up with very high sugar one night. So finally, we could not understand where is his sugar coming from, because his wife said, no, he did not eat any sweet, he did not eat anything, but he had on that day 6 diet colas, 6 of them, and his sugar shot up. So we realized that maybe the chemical, the preservatives in the diet drink, which are actually 0 calorie, but the chemicals are short circuiting his digestion and his insulin. So that's how we started understanding this whole thing.
Before we move on, one last question. So, for somebody who is having a prolonged issue with diarrhea for about a month, the person is having diarrhea. So, what is the prognosis, or what could be the underlying situation here, doctor?
If the person is having diarrhea for persistently for 1 month and he has tried all the home remedies and been to a general physician and taken treatment, and that is especially a course of antibiotic with anti-amoebic in India, and even if that the diarrhea is persisting, he will need to be investigated. Baseline blood investigations, ultrasound, and an endoscopy. So on these investigations, if we come to a diagnosis, we treat it. This is a very common disease, very commonly encountered, but finally we catch the reason and we accordingly treat it.
Okay. Right, doctor. So now moving on, when we talk about appendicitis, right? So within my limited understanding, it basically is a vestigious organ where your food waste gets collected. So there was a question about whether detox can help in removing food waste accumulated in appendix, or how to prevent appendicitis.
No, see, as long as you call it a vestigial organ, agreed, but the food waste getting accumulated in appendix is a wrong statement. Appendix is a part of the intestine where the large and the small intestine join to each other. There's a small appendage there, a small outgrowing there, which is called the appendix. Normally, nothing gets accumulated there. No form of any dietary habit which keeps your intestine healthy will keep the appendix healthy. There is nothing we can do separately for the appendix. So normally when we say appendicitis, it is infection of the appendix. As appendix is part of the intestine, so any intestinal infection can also affect the appendix. But normal intestinal infection gets controlled by the antibiotics. Because it is outpouching, once it gets infected, it's difficult to get controlled by the antibiotics, and at times we land up in the surgery. But there is no specific dietary or lifestyle changes which, as a doctor, we advise for keeping the appendix healthy. All dietary habits which keep the small intestine healthy will indirectly keep your appendix also healthy.
Understood, doctor.
At times we come across people who take enemas for some intestinal problem, we as doctors don't advocate it. We don't see
Understood.
any
Okay.
advantage of that.
I think this is a very common misconception.
Yeah.
Right. And so one person who's attending the webinar had asked this question that uh, he or she is getting mild pain in lower right abdomen whenever the person is eating out. So could this be appendicitis? So I think the person
Yes.
is not.
No, no. This low low grade infection in the appendix at times keep on coming again and again as mild pain. But if the infection increases, it becomes serious. But right lower abdominal pain is appendicitis or can be appendicitis, a different issue. But there can be many other reasons for right lower abdominal pain. Any intestinal infection can cause right lower abdominal infection, and amoebiasis is one of the most common. In India, tuberculosis is a very common problem. So that all needs the proper history, examination of the patient. We have to see all the parameters to decide what chances of which disease is more in this patient.
Thanks, doctor. Now, when we talk about gallbladder, so why do we have stones in gallbladder is a question we have received. Is there any surgical way to remove them? Non-surgical, sorry. I'm assuming there are surgical ways. But I think they talk about in kidney stones, there are non-surgical ways where you try and you take herbs and get the size of the stone smaller. But is there such a treatment available for gallbladder stones?
The basic difference between gallbladder and kidney stones is kidney stone has a way out. It can come out through your urinary tract. But in the gallbladder stone, it does not have a way out. If it tries to come out of the gallbladder, the problems are more to the patient than it's staying inside the gallbladder. Till date, we have not been able to find a specific reason why patients have these gallbladder stones. There are many theories, many hypotheses that this is the reason. It is seen region-wise. There are certain diseases like certain blood hemolytic disease which gives more chances of you having a gallbladder stone, but they are rare conditions. In most of the cases, we don't find a specific reason. We very commonly say fertile female of 40 are more prone to it, but then we don't have any specific reason for gallbladder stone. As I told you in the initial stages, North India, Haryana, Delhi, Uttar Pradesh, it's a very common disease. Go to South India, Kerala, Karnataka, it's not there. But till date, we have not been able to find a medical way of treating gallstones. It is one of the most common surgeries in the world. The day someone comes up with a right solution, he'll get a Nobel Prize.
Right, doctor. Now, what are the symptoms for a gallbladder infection? How can a person know that it's a gallbladder infection? And what are the ways to keep a healthy gallbladder?
Yeah. So gallbladder stones normally till they become infected, symptoms are like you have gastritis or what you have after having a heavy or an unhealthy meal. Fullness of stomach, bloating, gastritis. These are the common features. But at this stage, they are not picked up because people don't get investigated at this stage. Once the gallbladder gets infected because of the stone, then they have severe pain that is limited to the start from the right upper abdomen, goes to the back, and may spread to the whole of the stomach. That is the time, because the pain is so severe, the home remedies don't help. They go to the doctor, an ultrasound is done, and then they pick up the stone. Once we know the patient has a stone, then we advise them to have a low fatty food. Gallbladder function is to store bile, which it releases to the stomach when a food item comes into the stomach. So when the gallbladder is made to work, it causes pain. And fatty food causes the gallbladder to work more. So we say low fat food is good for the patient till they get the surgery done. But once the surgery is done, after that, we don't have any specific restriction to food after gallbladder surgery. It's a very misconception, very big and very common misconception that after the surgery, you're not allowed to have fatty food or not allowed to have this or that. After surgery, we never advise any dietary restriction to the patient unless that restriction is good for his overall well-being. We don't say that you have fatty food because you have had your surgery done, but if the person is thin and he wants to have fatty food, we have no objection to it.
Thanks, doctor. And there was a specific question when we talk about gallbladder. For a person who has their gallbladder removed back in 2010, the person is suffering from hyperacidity and digestion problem.
Yeah.
So the patient was asking, what is the problem and what is the cure?
So this is encountered very commonly. So we keep on blaming the symptoms to the surgery. It can be because of the surgery, but in most of the cases, if we investigate and find some other cause and treat it, if this patient has goes for an upper GI endoscopy, they might be able to find a cause and treat it in the symptom and go away. But if this is because of the gallbladder surgery, she'll have to live with it, because then whatever is causing the symptoms is not something which we can change. But if it is due to some other reason, which most of the cases are, you will be able to treat it. She will have to go to a gastroenterologist, get an endoscopy done, get the routine investigations done, and if they find something, they will treat it and the symptoms will go away. But she should not keep on not treating it, blaming it on the surgery.
Thanks, doctor. When we talk about gastrointestinal issues, something which has been very less talked about, but is a major problem is piles. So when I was looking at statistics, I saw that about 50 to 60% of the population at some point of time was inflicted by piles. I mean, I could the numbers could be wrong, but some data on online. Right. And when we talk about files,
Nitin,
am I audible? Hello.
your audio is not clear.
Yeah, Nitin, can you?
Is it better now?
Yeah, it's better.
Hello?
Yeah, this is better.
Sorry, I think there was an interference from the fan. So I was talking about piles as a condition. So I was just doing some background research, and I was seeing that there's about 50 to 60% of the population who gets inflicted by piles at some point of time, but it is very less talked about, right? So I was thinking, is there a way to predict piles early on?
See, piles is a very common disease, not only in India, all over the world. And it is never talked about because it's an embarrassing disease. People don't tend to discuss it with friends or so, and they keep on delaying the treatment. And in India, anything related to the anal region is considered to be piles when it is not true. So, for the general public, the basic concept is constipation is the basic reason for all anal problems. If we can manage the constipation, we can keep the disease under control. I don't say that disease is only seen in people who have constipation. It can be in anyone. It's a disease which can affect anyone. But if you have the disease and you have constipation, the disease gets multiplied. The symptoms get multiplied. And in India, anyone who's not able to clear the bowel completely calls himself to be suffering from piles, which as a doctor we don't agree to. Your stool habits or your constipation or your diarrhea or you're having heart stool does not mean you have piles. Piles is the name of a specific disease which can be diagnosed only if the patient has pain or bleeding while passing stools. If these two symptoms are not there, patient should not consider himself to be suffering from piles.
Thanks, doctor.
So I just want to add a little bit of that to to prevent constipation from happening. What are the few thumb rules which one should follow? The first thing is that in natural medicine, there are three kinds of constipations which have been defined. The first constipation is dry constipation, where there are dry, hard stools. And in this case, the reason is lack of water. That means you're not having enough water. Lack of lubrication. That means you need to drink things like aloe vera juice, have more bananas, which lubricate the entire lining. And in some cases, it's also advised that maybe your oil content is not right. Maybe you're not having the correct oil content. And maybe you should use more of kachi ghani oil, which is cold pressed oils, and that also preferably maybe coconut oil or till oil, which is better. The second kind of constipation is in which there is indigestion also associated and some bit of acidity and then constipation. In these cases, fundamentally your diet is very acidic. That means too much of masala, too much of fried food, and too little fiber. In this case, basically things like amla are given, and we will be sharing a juice for immunity in which we give tomato, apple, amla, beetroot, and pumpkin, and all them are juiced together along with ginger. So this is a very good recipe to make sure your intestines stay alkaline, and you have to not have low fiber diet. So you should have enough fiber. I'm not saying that go berserk on fiber, but have enough fiber. The third constipation is basically not really constipation, but a sluggish stomach, sluggish bowel movements, in which exercises and fiber both are equally important. See, a lot of times people are not moving. Now, if you don't move your entire muscular system, which is your core muscles, your back muscles, and even some of your internal, the internal organs, they start becoming loose. And some of the yogic asanas like the bandh, you have Jalandhar bandh, you have those some of those yogic exercise, they make your like in pregnancy, it's, some of the Kegel exercises are given to make the sacroaxial, coccygeal muscle strong. Similarly, it is important to do some of these yogic bandhs, which are exercises on how you do it. They make the whole system stronger. So that is the third kind of constipation, where exercises, fiber are both equally important. So if people can kind of understand what they are lacking basis what we have explained, they'll be able to a large extent prevent constipation.
Yeah, and I would like to add here, see, whatever we eat after being digested, it is passed out through the stool passage. So it takes around 8 to 10 hours for something to move from the gut, from the stomach to the, if we don't have enough fibers, the bulk is not there, the peristaltic movement is reduced in the patient. And that is a very, very common cause of constipation in modern world because of refined food and everything polished and no fibers in the diet. Other is the regular circadian rhythm of the person. If you have a habit of passing stool at a certain time daily, the body is tuned to it. So the body as a reflex works that the movement is there and you go to the toilet and you feel like and the pressure is there, you can pass it. But what happens nowadays that if you are used to going to the stool in the morning, most of the days you are so busy at that time, your brain tries to postpone it. And once it tries to postpone it, the food stays in the intestine for a longer period of time. In the large bowel, the water is absorbed from the excreta, and that makes it still harder. And once it becomes harder, it becomes difficult to pass. So regular lifestyle, regular stool timing of the stool is very important to prevent constipation. In a lighter term, I very frequently tell my patients that we have to train our body like we train our pets, dogs. उनको ट्रेनिंग है कि भाई आप लीश में लेके बाहर जाओ वो स्टूल करता है. So that is their brain working. So you take them out 5 times, they'll pass stools 5 times. You take them out 2 times, they'll only pass 2 times. So their brain works with this leads to passing. This is a stimulus for you to pass stools. So same day, I advise my patients to develop a healthy habit. I don't say, so certain people, elderly people, they have cigarette before passing stool. So that's an unhealthy way of training your brain. But if you can train your brain to have a glass of coffee, a cup of coffee, tea, or a honey water, or warm water before passing stool. So even if you don't have the pressure, if you have that, the brain will say that it's the time to pass stool. And you will be able to pass stools at the right time. And that helps a lot in patients with chronic constipation.
I'm so glad you said this, because I see a lot of young children who are going to school. They don't pass stool in the morning, and then the whole day they are in school, and in the evening then they try to go to the washroom. And I think this cycle is also very disruptive for their studies because it sets the wrong cycle in place.
And nowadays this call duties, shift duties is a very common problem with young people. They are working on American time. They have whole night they work, daytime they are sleeping. So this also changes their circadian rhythm. This is a very common cause for piles or for constipation.
Correct.
Right. So there were a few more questions before we close the session, because since we are closing to the end time, there was a question about umbilical hernia, doctor. So how many years can you basically postpone a surgery which is required for umbilical hernia?
Yeah. Nitin, before coming to this topic of umbilical hernia about piles, I would say the treatment of piles in India is so discredited because the previous ways we used to treat it, surgical ways, it was so discomforting and so. But now we have such simple laser treatment for piles. It's like a 15-20 minutes job, and it is something which gives you lifelong relief. So patients should not try to avoid treatment of piles. Now coming back to this question of umbilical hernia means patient is feeling some bulge near the umbilicus. So umbilical hernia are two types. One is congenital. A person has a loose umbilicus and he feels a small bulge from his childhood. But if that is the case, the patient does not have any symptoms, no pain, nothing, no treatment is required. But otherwise, if the patient has started feeling a bulge recently and he can associate it with some pain in that area, the surgery is not to be postponed. It is not an emergency. That means he doesn't have to go and get operated tomorrow, but he has to plan that. He has to plan today that in next 6 months I'll get it operated. Not wait for any symptoms to increase. So it's a planned surgery, not an emergency, but not to be waited for the symptoms to come.
I think, Nitin, there is some question on severe gastrointestinal pain. Do you want to take that?
Right, yeah. So another question, which was about the general gastrointestinal pain, which is very severe and acute compared to the usual mild pain. So what could be leading to this?
Shikha, I answer for this question for me will be specific diseases.
Yeah, actually, I wanted to tell the person who's taking question, who's writing that see, it's very important. Anything which is severe, always remember, please go to the doctor immediately, because it could be a crisis. And I mean, if you remember that when peritonitis we used to see in our LNJP hospital, it was a crazy condition, peritonitis, which is something has burst inside the stomach and the infection has now spread to the entire lining, which normally is sterile. That means it is zero bacteria. Anything which is severe needs an urgent doctor's attention. Don't wait. Don't keep popping pills or painkillers. Never take a painkiller for which you take for headache for your stomach. It is really not recommended, because the painkiller for a headache is very different from something which is happening in a stomach, which is a spasm or intestinal spasm. So I would say please consult the doctor as a first priority, because extreme pain is not to be taken lightly. And like Dr. Manish has already said, there are different organs in the body, like the pancreas, there is liver, there is gallbladder, there is appendix, large intestine, small intestine. So unless a proper diagnosis is made, it is hard to understand where the problem is coming from.
Yeah.
And I think there was another question that there is an elderly lady and she's having loose motions and gas, and she cannot put on weight. In such a condition, do you think there could be, what do you say?
Elderly lady who's having
She's having a stool. She's passing stools frequently and gas, and and she's plus 75 kilos, and she's not able to put on weight. So her weight is very low. I think it is how much is it, Nitin? Can you just check?
Um,
So the thing is that if this problem is of recent origin, then we have to rule out multiple diseases, starting from simple intestinal infection to diverticulitis. These lead to severe pain with loose motions, with blood in the stools. Then there are the same Crohn's and ulcerative colitis comes. Then at times certain intestinal malignancy leads to the symptoms that the weight loss is there and the patient is having recurrent pain, loose motions or constipation. So basically such patients will always require investigation for starting of any treatment.
Right. So normally, with aging, what are the changes which happen to the digestive system? Like people in 75, 80 years, what are the usual...
As you were saying, a sluggish bowel movement is a very common problem with age, especially with diabetes, neuropathies. These lead to decreased bowel motility. Decreased bowel motility leads to chronic constipation. Chronic constipation is not disease in itself, but it's also a mental disease. So all multiply and cause multiple problems.
Right.
And with
Right.
age, the food intake is not good, the exercise is not good, and all these things multiply and cause multiple problems.
I want to touch upon a little bit about like people sometimes, to lose weight, what they do is that they eat and then they vomit. Any any advice on such things?
No, no, we are clearly no to it. It's just not medically advisable.
Yeah, because I see a lot of patients, what they do is they eat all the food they want to eat and then they kind of vomit it out, and bulimia. So bulimic patients
Hmm.
also we have
As you
seen.
were saying, so the acid in the stomach is now coming to the food pipe because of that forced vomiting. It is not supposed to come to the food pipe. It's to be in the stomach and below. So whenever you are vomiting, when after vomiting you feel burning. That is because of the acid coming out. So you are forcing that to happen. So the food pipe gets damaged because of this, and it leads to long-term problems.
So you had also mentioned that after eating one should not sleep. Could you just explain a
Yeah.
little
So,
bit?
so so that's a simple. The logic remains the same as you said. We don't want the acid to be coming to the esophagus. So when you eat, the acid is pumped into the stomach for digestion. So once the acid is there, if you lie down by force of gravity, if you have a relaxed hiatus or a hiatal hernia, it tends to come to the to the esophagus and cause all the problems.
Right, right.
So there were a few questions which are a little detached from the topic, but still would be interesting for our audience to know. So when we intermittent fasting, is it good for those who have BP low and having iron deficiency? So nowadays the thing is all the household chore and there is kids at home doing online classes. So there's a lot of workload and they're not able to take care of their health. So they were asking whether intermittent fasting is a good way to go for a person who has low BP and iron deficiency.
So I think let me explain that to others what they mean by intermittent fasting. So basically, in intermittent fasting, it is a feeding and a fasting cycle. So within 8 hours window, people have to eat, and then 16 hours they have to give. They don't have to eat. They have to stop eating. So this is called intermittent fasting, which is 8 hours of eating window and 16 hours of no eating window, which is a fasting window. Now, having said that, I think people do not understand one thing, that intermittent fasting is only talking about the time of eating, not eating. What you are eating is more important. Now, if in the eating window you are eating bread, you are eating yesterday's sabzi, you are eating biscuits, or you are having 3, 4, 5 cups of tea, which is like kada hua chai, which is boiled, over boiled tea with a lot of sugar. If you are having always white rice, if your fiber is low, then even this intermittent fasting will not help. Now, connected to this, I want to touch upon one thing, that the circadian rhythm of eating is very important. That means that when you wake up and there is exposure to the sun, it is connected to your circadian rhythm. That means if you don't get any sun, your circadian rhythm gets affected, which affects your hormones also. So when you are eating in a cycle, try not to have late at night. One of the communities in India, which is the Jain community and the Jain philosophy, they believe that people should not eat after sunset, which was that you rise early, do your work, eat whatever you need to follow a routine, and then by sunset you start shutting down your, eating and everything, so that your body gets rest. So it is very important that you cannot be eating like 12 at night and 2 at night, and then you are next time eating at 12 o'clock in the afternoon. This kind of rhythm leads to acidity and indigestion and many other health problems. So again, to give you a short answer, intermittent fasting, more than that, I would say what are you eating is in that eating window is more important to your weight loss and your overall health. Now, if you already have low BP and if you have iron deficiency, that means your choice of foods is not correct. You're already suffering from some of the malnutrition problems. So you need to correct the foods.
Yes, ma'am. Before we close, there was a question about immunity boosting and a meal plan for that. For the benefit of viewers, I'm just sharing the details of Vedic diet, where we have an immunity diet available for 2 weeks, which is completely free. So please feel free to use this uh, app and get your health better. And before we close the session, I just want to talk about a gut health assessment that we have built on our website, where you can there will be few questions and you'll be able to understand where you are in terms of gut health. And then you will be able to understand what you need to do. So we also give some recommendations as in what you should be doing. So please feel, I'll be sharing the link on the chat. You can go over there and do the test and understand where your gut. So it's very simple questions. You just need to choose answers based on how you are treating your stomach. Right. And when we talk about food intolerance, we have a blood test with us and please feel free to do it. And we provide a 1 week consultation based on this. So I'll be sharing those links in the chat. And other than that, we are good to go with the session.
So I would like to, I think, Dr. Manish, can you help our viewers to understand if they want to consult you, where all are you available and how, they can reach out to you. So maybe the places where you are available, and then Nitin can share your email details and other things.
So I am working as a surgeon in Max Super Speciality Hospital, Saket, and Max Multi-Specialty Clinic in Panchi. And I have my own clinic in Sarvodaya Enclave in South Delhi. So I'm available daytimes in Max, either of the Max, and the evening in my clinic, and limited myself to the south of Delhi only.
Yes. And I think maybe you can show the website, Nitin, of Dr. Manish Agarwal's website.
So what we will be doing is after the webinar, we will be shooting out SMS to all the registrants with the details to contact Dr. Manish. So right now I don't have the website details from Dr. Manish.
Okay.
I'll be sending it.
Yes. So what we can do is that all the people, you'll be getting details of how to contact Dr. Manish and his email ID and his contact details. So please feel free to reach out to him for any intestinal problem. And I would like to say one thing, that, intestinal problems are the most neglected, because unlike a heart attack, people kind of keep having churn and this and that and trying to kind of self-treat it. So talking to a expert doctor who's a specialist in the field will always help, and obviously you'll be able to manage it better rather than getting the problem worsen and then finally having a crisis and then going to the emergency and then getting treatment. So any closing comments, Dr. Manish Agarwal?
No, so I want patients to take it very seriously. Intestinal problems are not to be taken lightly. Home remedies do work and work in maximum number of people, but if not, then you need to take expert opinion. And other thing which I want to add, I don't know if it's right or wrong, thinking that home remedies or churn have no side effects, I don't agree to that. Anything which is coming in a concentrate form can lead to side effects. When we say ki amla khalo, that is perfectly fine. But when you start getting amla ka powder from the market, then you are not sure about what you are having or how much you are having. And that can at times lead to certain problems which you don't relate to the thing you are eating.
I think very well said, and I'll give you two examples. Some of my patients are overdosing themselves on laxatives. There's some of these Senna laxative. So a lot of children come with Senna laxative and they overeat to the point that they are harming their intestine. So this I've seen very commonly. Second thing, just yesterday, somebody asked me that can I have kacha mango 2-3 every day? I said, why? For vitamin C. I said, have one amla, that's enough. No, I like kacha mango. So I think sometimes we try to take liberties with food which are not right, because like you rightly said, that when you have churns, they're concentrated. So you cannot mismanage and eat them wrong. Now, this was really interesting. And thank you so much. It was a great session. I think we tried to cover as many questions as we could. And I hope if more questions are coming, we can always, send the patients to your clinic. And
thanks a lot, Shikha. You were great as usual. And thanks, Nitin, for being so clear about what you want to show.
Yes. So, Nitin, thank you for moderating. And if you could close the session. And
yes. So with that, we would like to close the session. But in case there are questions which are about gut health, which are still there, please feel free to go to our website, www.drshikha.com, and go to a community and share it with us. And we will be, our team of doctors and nutritionists will look after it. And if it's something about surgery and something specific for Dr. Manish, we will be sharing with Dr. Manish.
You can direct the questions to me. Nitin, you can direct the questions to me.
Definitely.
And that can be sent to the people who require.
Yes. We'll be doing that. So what we do is we have a mail ID ask@drshikha.com. So if you have any questions, please feel free to send it out to that, and we will be forwarding those questions to Dr. Manish. Right. With that, I would like to close the session. I would like to thank Dr. Manish and Dr. Shikha for attending the session and making it very insightful and entertaining. And I would also like to thank all the attendees for asking such insightful questions, which is helpful for the other viewers as well. Thanks, everyone.
Thank you. Thanks a lot. Thanks.